Good evening. It's being heralded as a major breakthrough in treating diabetes. Overweight patients with the disease who took part in a trial treatment have stunned doctors by shedding a significant amount of weight in a matter of weeks. Doctors in Birmingham who led the trial also noticed blood sugar levels drop dramatically and fitness levels imprroved.
This is kind of like having bypass surgery without the operation. It's a device that's being tested by British researchers and early results look pretty good. Harnaik Fahakni, who lives in England, has struggled with his weight and diabetes for years.
I was very obese, overweight. My blood pressure was very high. My cholesterol was high.
Now the father of two is down nearly 50 pounds and 10 inches around his waist after getting an experimental device called the EndoBarrier.
Nick had a plastic tube inserted through his mouth into his upper small intestine. It was then opened up to act as a 2-foot barrier, stopping food being absorbed into his blood. The procedure is less dangerous than surgery and simple to teach. The tube was then removed after a year.
So this is it. It doesn't look much for £3,300, but when you consider that diabetes costs the NHS £11 billion a year, and that could double in the next 20 years, then this could turn out to be a good investment.
Diabetes is a vicious circle. The more insulin people need, the more obese they become. Nick says this has given him new life.
Especially my age, where it's very difficult to lose weight. I couldn't really imagine that I'd be at this weight and this size, let's say, a year ago when I first went on this clinical trial with the EndoBarrier.
But the doctors involved in the study said that they've seen liver fat reduce drastically and believe it can save lives.
I've seen huge numbers of patients over many years, and this group of patients are very different. It's the amount of happiness they have at of the treatment we've given them.
Well, I'm joined now by Dr. Robert Ryder from City Hospital and Corinne Karim, who's undergone this treatment. Welcome to both of you. Dr. Ryder, if I can turn to you first. I mean, this really does seem to be quite a significant step forward in treatment of diabetes. Just give us an idea of how big a breakthrough it is.
Well, that's certainly my view, because we haven't had a treatment that is so simple for patients in this particular situation, where they've come to the end of the line with all the other treatments and they're still with poor diabetes control and still overweight. And this is such a simple thing to put in an endoscopy, and endoscopy units are all over the NHS already, so potentially it's a big step forward.
And it's been a big deal for you, hasn't it, Corinne? Just give me some idea of the difference this has made to your life.
This is, as you can see, it's an amazing transition. I feel a lot better in myself. I can breathe better. I had a lot of fat around my liver. My cholesterol levels were really high. Other doctors thought I was an alcoholic when I wasn't, due to the fat around my liver, and that's completely gone. I'm not in pain. I can move just like a normal person.
You lost so much weight. In fact, you can't quite remember how much, because it was about 3 or 4 stone or something like that. So what can you do now, Corinne, that you couldn't do before you had this treatment?
Well, I'm a lot healthier. I can control my diabetes a lot better. It still feels like I have the EndoBarrier in. It's like something's telling me to stop. Before I would just eat and eat and eat because I didn't have control, whereas that's helped me have control. And my sugar levels are a lot better.
And that's absolutely crucial, isn't it?
My name is Dr. Bob Ryder, consultant diabetologist from Birmingham in the United Kingdom, presenting data on the first NHS EndoBarrier service in the United Kingdom. And I'm presenting data today on the first 12 of these patients who've reached 6 months after the EndoBarrier was removed. These were their baseline characteristics, and I point out in particular the long duration of diabetes, median of 17 years, and that was 75% were taking insulin. So these patients have had diabetes for many, many years, many treatments have been tried, and yet they remain overweight with poor glycemic control. This is what happened to them after a year of EndoBarrier treatment, and you can see the weight fell by 17.6 kilograms, nearly 40 pounds. Hemoglobin A1C went down from 9.6% to 7.2%. Big drop in systolic blood pressure and in alanine aminotransferase, presumably reflecting a reduction in liver fat. A big drop in the dose of insulin you can see there, and 3 of the 9 patients were able to discontinue insulin. These are the individual plots of the patients over the 18 months, including the 6 months after the EndoBarrier was removed, and you can see the 9 green plots represent 9 patients who sustained the improvement over the 6 months after the EndoBarrier was removed, and the 3 red plots are those patients who didn't, and all these 3 patients had major problems with depression. These are the same patients, and those that maintain the improvement in weight also maintain the improvement in hemoglobin A1C, whereas there were 3 patients in whom the hemoglobin A1C had a problem. This patient here did sustain a lower hemoglobin A1C, but this was due to a big increase in the insulin dose and therefore can't be put down to anything to do with EndoBarrier. Looking at the means for the groups as a whole, for the hemoglobin A1C between 12 and 18 months, there wasn't a statistically significant rise, though there was an increase because of the 3 patients who deteriorated, but yet the group as a whole remained very much below the baseline hemoglobin A1C, and this also applies to the weight and BMI. The insulin dose, you can see in the bottom right hand corner, continued to fall, and indeed a further patient came off insulin, meaning that 4 out of the 9 patients on insulin were able to discontinue insulin.